So in the summer of 2009, I started having really bad headaches right behind both of my ears. And it was a unique headache in that it would not go away. It was just always consistently there. I had to learn how to deal with it. For 6 months, I dealt with it. I went to countless doctors, probably over 15. And at the very worst, I was told in the emergency room that I was probably going to have to deal with these headaches for years to come. It was something that I had just had to accept. One day I heard about Joe Roden, and so I went to go and visit him, and after 2 appointments, he was able to pinpoint exactly where my headaches were coming from. And through treatments, my headaches have gone away.
Well, when Megan was first referred to me, she was referred because she was having headaches that were uninterrupted, meaning that they were ongoing headaches that maybe fluctuated a little bit but never really went away. And the first thing I did, there were a couple different phases to my assessment and treatment with Megan. And the first thing I did was to just check some certain areas on her neck and on her head that indicate muscular spasms and nervous spasms that are a result of nervous system being set in a certain position. So these aren't the kinds of things that perhaps a massage therapist might be able to work out a muscle spasm and people are happy. These are different quality of spasm in tissue that has to do with the nervous system being stuck and unable to reset. So when I first saw Megan, just initially to see if I might be able to help her, I checked some of these areas, and it was gratifying to me that a lot of the areas that I checked on her were actually pretty agitated, and she corroborated that they were pretty painful. And that meant to me that perhaps I might be able to make a difference for her. Some people have these very difficult headaches, and they're enigmas to the whole profession. And then there's other headaches that are very amenable to certain kinds of intelligently placed manual hands-on work. And not everybody's familiar with them, from the professionals to the lay people. So when I checked with Megan to see where these points were and how they felt, and they were in fact pretty hot on her, I thought, well, perhaps I might be able to make a difference for her. So Megan, do you remember that first time when I just assessed you briefly and what was going on with you at that time?
Yeah, I do. I was in an incredible amount of pain. I had been for 6 months. I've been to countless doctors, and everyone was just kind of telling me, you're going to have to learn to deal with this and you're going to have to live with it. So when I went in to see you, I was really happy when you were able to kind of check those pressure points and tell me, this is good news, that we figured this out, that there are specific points that we can try and treat. So I remember that assessment. It was just all about kind of just trying to figure out what was going on and what the best way to attack it would be.
Mm-hmm. So that's where things started with Megan, and then we made a series of appointments to see if we could take it to the next step. And there were a couple steps in the treatment with Megan. The first one, as I said, was to go ahead and work with these points that were mostly in her neck, shoulders, and head. Headaches, although they might express themselves with symptoms in the head, it's not always clear where their origin come. They can come from the neck and the shoulders, the jaw, the head. And so what we did is we just methodically cleaned up some of these points where her nervous system was highly irritated, with the idea that, one, that might be the cause of the problem, or two, in order to treat the cause of the problem, we're not going to get results without helping her nervous system to relax, which would then allow her soft tissues and muscles to relax. We had Megan go home and do some heat and ice, I believe, and you did that.
Yes, I did.
Megan is a good patient, and she's motivated, and those are the patients that get better. So she took a very active role in her own treatment.
Pain motivates.
Yes, pain motivates, and she was curious, so we had a lot of good talks about what was going on in her body. And so we had a very good effect, and I was cautiously hopeful when after that treatment, and sure enough, it's not every time, but there are a number of times when we see these kinds of symptoms, when we see these kinds of treatment effects, that there's reason to be cautiously optimistic, and Megan was one of those cases, so it was very gratifying. That wasn't the end of the story, but that was the significant piece. Now we knew that the headache wasn't going to overtake her. We were going to beat the headache. What we did since then, because Megan's situation, she fits into one of two categories. Some people, they have auto accidents, they have falls, they have trauma, and that leads to pain. Then you have other people for whom they didn't do anything that they can remember, and all of a sudden they're in a ton of pain. And Megan fit into that second class of people where she believed you were on an airplane, did just a couple things weird, and all of a sudden, all hell broke loose, and you couldn't put it back in the bottle.
Yeah.
So when I hear stories like that versus people who have certain trauma, I have to open my aperture a little bit and look at the bigger picture, because while being on an airplane is pretty uncomfortable and it's enough to make your neck hurt, it's sometimes reasonable to think that she was predisposed for some reason, and that she was close to a tipping point, and something which might be stressful but should be tolerated, her body maxed out and couldn't tolerate it anymore. So part of my ideal way to work with people is to treat them, find the cause, get them over the hump, and send them on their way. And that's what I like to do with Megan. However, because it appeared that she was predisposed, I felt it was important to try and just step back, take a look at the bigger picture, and see, is there anything in Megan's structure of the way she carries her body, or some things that are going on in her body that are putting her in an adapted state that make her more vulnerable to hitting that threshold that we can all hit of being in pain. So we did look at Megan that way, and we were able to find some things in the way her body is aligned and adapted that are putting some stress on the atlas. So what we're doing at this point is really the finishing touches, which is, what do we need to do for Megan so that she can stay pain-free ongoingly? We don't want to get in a situation where she goes to her doctor to get herself treated real regularly. We'd like her to come in occasionally for maintenance, but we want her out on her way, having fun. She's in college. She should be doing the things she wants to do. So the bigger picture with Megan is to try and get her body in such a state that her atlas is not in a precarious position and vulnerable to going over the threshold. So that's our final piece of work with Megan, to help the different bones and so forth stack themselves in such a way as to leave her atlas plenty of room, plenty of slack to endure challenges, physical events, whatever, without sending her off to pain. So that's the finishing touches with Megan. That's where we're at now. We're working with some exercise. We're working with a little bit of treatment and some self-care. Again, Megan's a great patient, pretty motivated, and we're hoping that will take care of the nervous system and everything else, and then we can happily just send Megan off. And how are you feeling about that phase of the treatment? And
I'm feeling really good. I've been responding well to the exercises. I think they're making a difference, so I'm very hopeful.
Good.
He essentially took away a problem that I was going to have to deal with for 20 years completely. So I can't tell you how grateful I am for him. He's incredibly knowledgeable in his field. It was like magic going to him, so I've really appreciated everything he's done, and he's made my life a heck of a lot easier.